Well, this is probably the most definitive study to date showing the relationship between smoke-free workplaces and heart attacks. What we've shown here is a reduction in heart attacks 45% from before the time the smoke-free workplace laws went into place until after they went into place. But for the very first time, we showed a dramatic reduction in sudden cardiac death, a reduction of 50% from before the time the work sites went smoke-free to after they went smoke-free. Well, there have been many reports in the literature about smoke-free workplaces producing a positive effect when it comes to reducing heart attacks. But very few places in the country can capture all the medical information about a population the way we can in Olmsted County. It's called the Rochester Epidemiology Project, which has produced thousands of research papers on the incidence of diseases. So this is a very unique setting. So we thought that it would be interesting to study this in our setting to see if this is really a true finding or not. And what we found out that it really does reduce heart attacks. But the second thing we found out, it reduces and dramatically reduces sudden cardiac death. Just having the simple policy of smoke-free workplaces before and after reduces the incidence of both of those things. Well, I think for everyone, what this shows is that secondhand smoke is related to acute myocardial infarctions, and you should avoid any contact with secondhand smoke. But for patients with known coronary disease, they should avoid any contact with secondhand smoke because it's too dangerous, both for the risk of heart attack and the risk of sudden cardiac death. The global smoke-free worksite challenge, which we brought to the Clinton Global Initiative earlier this fall, is going to be really front and center because these data, the data from Olmsted County, shows that by doing that you can reduce the chances of both having a heart attack and dying of sudden cardiac death. So that's going to emphasize the health importance to make the global smoke-free worksite challenge universal. So we're going to use this information to help us convince corporations, convince countries that this is the right thing to do to protect the health of their workers and their citizens. The bottom line is that we now know that not only do smoke-free workplace laws help avoid having a heart attack, but they also reduce the chances of having sudden cardiac death. Those are both very dramatic things that have a very big impact on workers as well as patrons to these places that they go. So we think that everyone should avoid contact with secondhand smoke, and especially for people with known coronary artery disease or heart disease, they should have literally no exposure to secondhand smoke because it is too dangerous to their health.